Dr. Ken Landau, thanks for watching. Let's talk about Diovan or Valsartan. This is a very commonly used drug to treat high blood pressure. It was originally marketed in the United States in 1996 and went off patent. In other words, the price went down in 2012. You can purchase it either as Diovan or in a pill combined with hydrochlorothiazide. That's a water pill, very commonly used water pill. And that case is called Diovan HCT, or the generics Valsartan and Valsartan HCT, the drug used for treating high blood pressure, heart failure, diabetic kidney disease, and it's also used to prevent cardiovascular events, heart attack, stroke, in people who are at risk. When we talk about reducing the blood pressure, there's always the argument about what level do we begin our therapy. Is it over 160 millimeters of mercury for the systolic blood pressure? Is it over 140? Or more recently, the American Heart Association and the American College of Cardiology said it's 130. Don't buy that myself. But anyway, it's important to realize that the greater your risk, the greater the benefit. So let's say you have a blood pressure of 140 systolic. If it's just 140, you're at a lower risk than if you have a blood pressure of 140, the same thing, and you happen to be diabetic, overweight, smoke cigarettes, and have high cholesterol. So the overall risk needs to be assessed. It also is relatively good drug to help prevent further deterioration in people who have heart failure, where the heart can't pump enough blood to make your activities seem tolerable. And in some people, after a heart attack, it can prevent recurrence. The dose of the drug, well, it comes in 40, 80, 160, or 320 milligrams. Typically, once you take the drug, it reaches its peak concentration in your body in 2 to 4 hours. The body eliminates it by 50% within 6 hours. You can take it with food or without, but if you do take it with food, you'll have a decrease in the concentration in the blood system. But evidently, it's not enough to make much difference on blood pressure control. The medicine is taken out of the body, unmetabolized. Most of it goes out in your bowel movement. 10% of it or so goes out in your urine. The onset of blood pressure reduction is within 2 hours, maximum within 6 hours, and it lasts for up to 24 hours. Now, there's no effect if you take less than 40 milligrams, and once you get over 160 milligrams, it stays at a constant concentration inside the bloodstream. So that's relatively good. Now, if you have high blood pressure and you decide to stop the pill, you're going to have an abrupt increase in your blood pressure. If you start taking it and you don't have good control of your blood pressure within 2 to 4 weeks, then you can increase the dose. Let's say you started off at 80 milligrams, then the next would be 160 milligrams. You could take that all at one time, or you could take 80 milligrams twice a day. And actually, that might even be a better choice, because then you can for sure guarantee you're going to get the 24-hour coverage. And that's a problem. A lot of these drugs stop working a little bit before they're supposed to, in which case you have a certain part of the day when your blood pressure isn't controlled. And that typically is at night when you don't know it because you're asleep. Now, you can either take the drug by itself, or typically people who have high blood pressure end up taking several drugs. How much blood pressure lowering effect can you get with the drug? Well, if you take the average 80 to 160 milligrams of Diovan, the top number, which is most important for adults, is going to fall by 6 to 9 millimeters of mercury. If you go up to the 320 milligram a day dose, that's probably 9 or 10 milligrams. Now, if you happen to add the water pill, the Diovan HCT, well, the HCT will take you down another 6 millimeters, so that would be a combined 12 millimeters reduction. If you take a higher dose of the water pill, you could get even more benefit. Now, it's important to realize that when we talk about the blood pressure pills, they all do the same thing as far as the blood pressure is concerned. They all are geared so that a solitary dose is going to reduce the blood pressure between 6 and 9 millimeters or thereabout. So if you take Valsartan, or if you take an ACE inhibitor, maybe you take Vasotec, maybe you take the Zestril, or maybe you take another of the ARBs, the angiotensin receptor blocker, of which Diovan is one, all going to give you the same effect. Other names other than the Losartan, other than the Diovan. There's Atacan, Avapro, Benicar, and Micardis. They're all in the same family. Side effects, well, if you take the drug and your blood pressure goes down a little bit too much, maybe you have dizziness. 15-20% of the people, about 5 to 10% going to suffer too low a blood pressure. Some people going to get diarrhea, and some people going to be fatigued. Most of the side effects are short-term, they're transient, and we don't find a significant number of people discontinuing the drug because of side effects. But if you happen to be on a low-salt diet, maybe you're taking a diuretic, you have a heart problem, nausea, vomiting, then you got to be careful because your blood pressure, chances are, is going to fall a little bit too much. Some people have side effects of edema, swelling of the ankles or their feet. Some people get a headache. There's a problem with cough, and the ACE inhibitors, same sort of family as the ARBs, but here you don't get the cough. That's the major benefit. That's why you would pick a drug like Diovan or a drug like Losartan instead of the lisinopril, perhaps. Only difference is here you won't cough. Also, you could have sinusitis or nausea. Some people get joint pain. One of the problems is that the potassium level might go up. So you have to be careful. You have to measure the potassium, and especially you got to be careful about taking salt substitutes because they have a lot of potassium. You have to be careful of taking a drug like spironolactone or any other diuretic that actually makes you retain potassium. They could be dangerous when you take them with Diovan. Also, we know that the nonsteroidal anti-inflammatory drugs like aspirin or ibuprofen or naproxen can affect the ability of these drugs to lower your blood pressure, so they can be counterproductive. And then you can't take this drug and then another one that's commonly used in diabetics called Tecturna that's also used to reduce the blood pressure. Well, some people are taking lithium. They have manic depressive disorders and take lithium. Well, this drug, the Diovan, can increase the concentration of the lithium in the system, and that's probably not a very good idea. If you happen to have kidney disease, mild, moderate deficiency, then this drug is okay to take. We also know that the drug can be used in people who have heart failure, and it's typically begun at a relatively low dose. It also can be used in people who have had heart attacks, typically begun in a relatively low dose, and then slowly increase to the same levels that we would use in people who have high blood pressure. What do we have to watch? Well, if you're taking the drug, you need periodic monitoring of your kidney function and the amount of sodium in the system. If you're pregnant, you should definitely not take this drug, and if you're pregnant, you should discontinue it as soon as possible because it does lead to an increase in fetal toxicity, fetal death, skeletal abnormalities in the child. It leads to less fluid in the amniotic sac, and it can impair the kidney function of the fetus. By the same token, if you're a nursing mother, don't take the drug. If you happen to be elderly, the drug is going to build up in the system a little bit. The concentration is going to increase somewhere between 30 and 40%, but that doesn't seem to cause an issue. If you happen to overdose on the drug, your blood pressure is going to go down, your heart rate will go up, maybe you'll lose consciousness and have some circulatory collapse, but most people don't overdose on high blood pressure pills. How does it work? Well, it works through a complicated system in the body. The body makes something called angiotensin 1. And angiotensin 1 is converted by an enzyme known as angiotensin converting enzyme into the angiotensin 2. The angiotensin converting enzyme that converts the angiotensin 1 to 2, that's blocked by the lisinopril and the enalapril. Those are the ACE inhibitors, very commonly used drugs. Well, the ARBs, like Valsartan or Diovan, they block the action of angiotensin 2. They prevent it from docking on its receptor in the smooth muscle cells. Angiotensin 2 causes vasoconstriction, causes tightening of the blood vessels, causes the adrenal gland to release something known as aldosterone, stimulates the heart, all of which is blocked by the angiotensin receptor blocker. So that's where the benefit comes from. Now, it supposedly has cardiovascular benefits in people who have heart failure. Heart failure is when your heart just doesn't pump enough oxygenated blood to meet the body's metabolic needs. Typically, people have a relatively low ejection fraction, and they're at increased risk for some sort of cardiovascular problem, maybe sudden cardiac death, hospitalization, maybe acute myocardial infarction. And it seems that this drug can reduce the likelihood of some of those events from, say, 32% on a placebo to maybe around 29% taking the drug. Well, that sounds kind of good. And if you happen to have a heart attack, and you happen to have heart failure, and you happen to have a low ejection fraction, if you start the drug within 12 hours to 10 days, somewhere in that time window, 12 hours to 10 days after the heart attack, supposedly, at a low dose and then increase it as tolerated, that will decrease the likelihood that you're going to have an event. Now, you have to realize that Valsartan, or Diovan, is one of the best-selling drugs in the world in the family of the angiotensin receptor blockers to control blood pressure. In spite of that, in 2013, so relatively recently, the Wall Street Journal reported on 2 university investigations into the Novartis research activities over in Japan. And they noted that some of the results that were being published didn't really match some of the data. And furthermore, they noted that there was a conflict of interest that had not been reported, where 2 investigators who actually were working for the company were participating in the research. And as a result, 8 papers that were published from the Kyoto Heart Study, published in major medical journals like the European Heart Journal and the International Journal of Cardiology, they had to be retracted. They were retracted because the Japanese researchers were fabricating the data, telling us about how good the drug was. Well, yes, it reduces the blood pressure, but those investigations in Japan, they were suggesting all of the extra benefits as far as the heart was concerned, as far as reducing the congestive heart failure, reducing angina, reducing the likelihood of stroke. Now, all of that is in doubt. And actually, the Japanese investigators from the university, not the people who were doing the papers, the university researchers found that if the doctors would have used the entire patient records, they might have found exactly the opposite effect. So the Japanese health minister actually said the data was fabricated and falsified. And not only did the Japanese make the company inform the doctors that the studies weren't accurate, but in addition, they had to report that there were 5 potentially life-threatening skin diseases that were associated with the drug. Unfortunately, most of the scandal was confined to Japan, so American investigators and American doctors aren't terribly well conversant with that. Now, here's another problem with the drug and with the drug family. There was a study that was published in a very prestigious medical journal called Lancet Oncology in July of 2010, and what it did is it looked at the incidence of cancer associated with these angiotensin receptor blockers. And what they found was that they block this pathway, or they interfere with the pathway that's important in cell proliferation, in new blood vessel production, and in tumor progression. And when they investigated about 61,000 patients in all of the randomized controlled trials to the time, they found that instead of a 6% chance of cancer on the placebo, people taking the drug had about a 7.2% increase, or 7.2% total in the likelihood of cancer, which means that there was about a 20% relative increase in the incidence of cancer. If cancer was looked at as a specific endpoint, it was an 11% increase. If they looked at specific kinds of cancer, for instance, cancer of the lung, it was somewhere between a 25% increase and more than doubling. Fortunately, no increase in the death rate, though. Several other studies were done. One from the Journal of Clinical Oncology in Taiwan showed that another ARB, known as Macardis, increased the cancer rate. Another one from German researchers found in 2011 that people who smoked cigarettes and took the drugs, they had an increased incidence of lung cancer. There was the Atacans study, and the Atacans study showed unexpectedly that there was an increase in fatal lung cancer, death from lung cancer. So instead of being 1.6%, it increased to 2.3%. Now that's a relative increase of 44%. So the FDA was sort of pushed, and they said that they investigated all of the data, and there was not any association. And then shortly thereafter, there were 2 more studies that came out and showed that there was an association. So a reviewer at the FDA, Dr. Thomas Marciniak, he said he wanted some time to go and do a more complete evaluation and actually look at the base data, the individual patient reports. But his boss, Dr. Unger at the FDA, said, nah, not necessary to do. Take too much time, and even if you did, and even if we found a 30% increase in cancer, we're not going to really change the labeling of the drugs. So right away we have a situation, and Dr. Marciniak, he argues that, hey, look, we really need to spend some time on this subject. 1, cancer is very important, and 2, when you look at some of the data, if a person on the report was found to have lung carcinoma, that wasn't even counted as lung cancer. And to make matters even worse, the studies on blood pressure control are relatively short. They're 6 months, a year, or 2. Well, if you start smoking cigarettes, a problem that we know is associated with cancer, you have to smoke cigarettes for 10, 20, 30 years before you're going to get the cancer. So here, if we're finding an increased incidence of cancer associated with these drugs for short-term use, what happens when we keep you on them for 20 years or more? Well, that's why Dr. Marciniak is cautious. So how much do you take of the drug? Well, typically people start with somewhere around 80 to 160 milligrams. If you're going to take it for high blood pressure, it can go up to 320 milligrams, either as 1 pill or as divided dose. We know that you can take some if you have blood pressure problems, and you can take it if you have the heart attack problem, and you can take it if you have the heart failure problem. Big industry in the United States. The whole family of drugs sells more than $7 billion, at least before they went off patent. Just in 2010, before it went off patent, Valsartan by itself sold $2 billion as Diovan just in the United States. And it was $6 billion for the entire world. Well, how much would it cost you? How much are you out of pocket to take the drug at the present time? Only between $10 and $20 a month, unless you happen to go to a place like CVS or Walgreens, where for some reason, even with a coupon from GoodRx, the price is $139. Doesn't make any sense. If you wanted, on the other hand, to take the trade name, brand name drug, if you wanted the Diovan instead of the Valsartan, that would cost $280. So what's the bottom line on this drug? Well, first, you have to realize that if you have high blood pressure, the first thing you should do is, if you're overweight, you should go on a diet. You should cut down the amount of salt that you consume, cut down the amount of alcohol that you consume. You should get more exercise. You should switch over, have lots more fruit, lots more vegetables, lots of nuts every day. Cut down on the amount of red meat, have more chicken, have more fish. If you do all of that, your blood pressure may well come down, and as a matter of fact, those changes give you the same benefit as taking 1 antihypertensive pill. We have some question and some controversy that continues about the drug. How does it do as far as anything other than reducing your blood pressure? Is it associated with cancer? Is it really beneficial to the heart other than lowering the blood pressure? Well, these questions have to be investigated a little bit more. But the critical thing is, if your blood pressure really is up, and if you've done all of those changes and you can't get it down, then the first choice is probably a water pill. Chlorthalidone is my favorite, or hydrochlorothiazide is sort of the standard. And then an ACE inhibitor, the enalapril or the lisinopril. And then if that doesn't work, then the choice is an ARB, because you have a cough with the ACE inhibitor, or perhaps a calcium blocker like amlodipine. Anyway, Thanks for watching. I'm Dr. Ken Landau.